Hello guys, and welcome back to Wellness Wednesdays. Today I want to talk a little bit more about norepinephrine. So we talk about norepinephrine quite a bit when we talk about the mental and mood effects of cold plunging, but not everyone knows what norepinephrine is. So that's what we're going to get into today. So norepinephrine, also called neuroadrenaline, is a neurotransmitter in both the peripheral and central nervous systems. Norepinephrine produces many effects in the body, the most notable being those associated with the fight or flight response to perceived danger. The effects of norepinephrine and a related catecholamine, epinephrine, also called adrenaline, are mediated by adrenergic receptors. Neuroadrenaline is derived from L-tyrosine, an aromatic amino acid present in the body fluids and taken up by neuroadrenaline-producing cells. So how is it released through cold plunging? Norepinephrine is stored in vesicles in the nerve terminals, which concentrates it and protects it from metabolism until it is released following nerve stimulation. The major mechanism by which the effects of norepinephrine are terminated is reuptake back into the nerve terminal by a high-affinity transporter. So again, norepinephrine plays a role in vigilance and conditioned fear, and therefore should always modulate unconditioned fear. Norepinephrine was shown to increase in the hippocampus in mice exposed to a cat. Furthermore, in a drug schedule of intermittent methylphenidate treatment for 3 weeks that sensitizes dopamine and norepinephrine systems, rats given a specific drug, which facilitates norepinephrine neurotransmission, displayed increased avoidance of a predator odor. Together, the studies confirm that norepinephrine neurotransmission is important for unconditioned fear to predators and predator odors. As a neurotransmitter in your brain and spinal cord, norepinephrine increases alertness, arousal, and attention, constricts blood vessels, which help maintain blood pressure in times of stress, and does affect your sleep-wake cycle, mood, and memory. In the medical sense, norepinephrine is used to increase and maintain blood pressure in limited short-term situations where low blood pressure is a problem. These conditions could include cardiac arrest, spinal anesthesia, septicemia, blood transfusions, and drug reactions. And usually it's used with other medicines for those conditions. It's also used to treat septic shock, neurogenic shock, and a condition in which fluid builds up in the space around your heart. It can also be used to treat critical hypotension. As a medication, allergic reactions can occur, difficulty breathing can occur, irregular heartbeats, and of course, pain, redness, and irritation. There are many health conditions that result from the low levels of norepinephrine, including anxiety, depression, ADHD, headaches, memory problems, sleeping problems, low blood pressure, low blood sugar, changes in blood pressure, and dopamine deficiency. And a lot of that explains why doing cold plunge and cold therapy does help with anxiety, depression, memory, sleeping problems, things like that. On the flip side of it, conditions that result from high levels of norepinephrine are high blood pressure, rapid heartbeat, excessive sweating, cold or pale skin, severe headaches, and nervous jitters. So if you have any of those symptoms, you can still go ahead and cold plunge, but maybe keep an eye on your blood pressure before and after, which I have done that. I have ran that experiment before with a friend, although we did only do it for 1 day, so we didn't really get any tangible data. But this is why many of the studies do refer to norepinephrine release, because norepinephrine is, from what we're seeing, basically the reason that cold plunging works for a lot of the other things that we've talked about, such as anxiety, depression, all those kinds of conditions. Now, there is a connection between norepinephrine and dopamine that I'm not going to get into in this particular video, but due to the nature of norepinephrine, it does make sense that a lot of the studies on mood, anxiety, depression, etc., talk about the release of norepinephrine in the brain, because that is what is helping trigger the fight or flight when you first get into the cold plunge, but it's also helping release and regulate the chemicals in your brain. So there you have it, guys. The release of norepinephrine, unless you have severe high blood pressure or anything like that, is going to be super beneficial for you from a mental as well as a physical state. And so as we move forward with our Wellness Wednesdays, talking about different studies, when we mention norepinephrine, you'll understand what we're talking about. Again, guys, if you are getting into cold therapy for the mental effects more than the physical effects, I do need to mention icewellnessjournal.com. Ice Wellness Journal is designed to help you track your plunges, the different variables in your plunging state, and help you find the best time and parameters to plunge. And then our monthly challenges give you a new mantra to help center yourself, a new workout to help you warm up after your plunge and get a little bit of exercise in. And then, of course, we do send out newsletters every month with some new podcasts, YouTube experts, or studies to look at. So our newsletter also covers things like how to keep your water clean, how often should you change it, and things like that. Again, guys, that is icewellnessjournal.com/info. If you don't want the journal and you just want to go straight to the monthly challenges, it is icewellnessjournal.com/challenge.